Hello, class and professor. This is my Unit 13 discussion on geriatric patients and clinical practice guidelines. So last week I had the pleasure of working with an 82-year-old Hispanic female with a past medical history of Alzheimer's, dementia, hyperlipidemia, hypertension, and kidney stones, who presented to the ED via EMS from the nursing home where she resides with generalized weakness and shivering times 4 days. The patient was a poor historian due to her Alzheimer's and dementia, so she had her daughter at the bedside to give us all the information necessary. The daughter stated that she received a call from the nursing home on Thursday, which was Thanksgiving, stating that since Tuesday, her mother was not acting herself, didn't want to get out of bed, wasn't walking, was shivering. The daughter did state that the patient usually walks, takes care of herself, eats on her own, does everything on her own. So this was very unusual. The daughter explained to them that it was Thanksgiving, she had family already over, and that wasn't going to be able to pass by till the next day, which was Friday. So Friday night comes around, she goes and visits her mom, but since it's nighttime, she noticed that her mom wasn't acting herself, but she let her sleep it through and was going to reevaluate the following day. So Saturday when she got there, the mom was acting different, didn't recognize her, wasn't getting out of bed, wasn't eating, was shivering. So she decided to call EMS and have her further evaluated at the emergency room. So in the emergency room, after running some labs and chest x-rays and CTs, she was diagnosed with a UTI and community-acquired pneumonia. So according to the Alzheimer's Association of 2023, it is important to plan ahead when you have a loved one with Alzheimer's disease, especially when going into the hospital. It's important to have a kit ready, such as with documentation, with the power of attorney, living will. That way we know legally who is in charge of making decisions for this patient. Also, other important documents to include are a list of past medical history, past surgical history, list of current medications, list of allergies, their diet preference. That way we can take care of this patient as best as possible, which the daughter did do. She brought us all this information with her during this hospital stay. So I was very happy about that. So as part of the clinical guidelines in treating patients with Alzheimer's, it's important to keep them informed of what's going on at all times. Being in the hospital is already stressful for anybody. So imagine with somebody with Alzheimer's and being taken out of their usual element, it's even more stressful for them. So as the hospital staff, it is important, to keep them informed of what's going on, give their loved ones extra time to be with them, that way they don't feel alone and stressed. So we did allow the daughter to be there the whole time. She was there the whole time that we treated this patient. And this patient ended up having a very good outcome. We treated her for her UTI and her for her pneumonia. We also made sure that we put the patient on fall risk precautions, aspiration precautions, put her on her puree diet that she prefers. She was constantly reoriented. And as we treated the underlying condition and infection, her cognition started getting a little bit better. So those are the clinical practice guidelines that we use in treating this patient. And that is my discussion for Unit 13. Thank you.